Welcome to the Pitch Sync podcast. I'm your host, Steven Flutie-Davis, and today we're tackling a topic that I think many of us, if not all of us, have faced at some point in our careers, and that's imposter syndrome. You know, that voice in your head that says you're not good enough, or maybe someone's going to figure out that maybe you don't belong here. Yeah, that's the one. It's relentless for those of us in MedTech, an industry already filled with high stakes, innovation, and constant challenges. And it can feel even louder for us sometimes, whether you're a founder trying to launch your own product, professional working your way up the ladder, or a seasoned leader that, is trying to move up in this space. Imposter syndrome really doesn't discriminate. But here's the thing. It's about silencing that voice and learning how to move forward despite it, and maybe turning it into a tool for growth. That's exactly what we're going to explore today. And I couldn't be more excited to have somebody incredible to hear to guide us through that journey, someone to unpack this important topic. And I'm thrilled to have Ingrid Ellerbe, the Executive Director of Diversity by Doing. Ingrid, welcome to the podcast.
Thanks, Steven. Thanks for inviting me.
I'm excited on this. We've had our pre-calls, and it's something that, again, a lot of us, there's some stats in here we'll talk about in a minute, that a lot of us don't realize how to, overcome it. It can, honestly, I think it can be one of those things that shuts down a company or shuts down a concept at early stages, or you don't get a promotion because of it. So it's an important
Absolutely.
topic. But before we dive into it, I want to tell the audience a little bit about what you're doing at Diversity by Doing.
Let me share a couple of things, Steven. I started with Diversity by Doing about 5 years ago, and it was really, really interesting because when we began, the focus was on gender equity. And so we always look at women as having certain feelings or not feeling like they're satisfied or they're not getting equal treatment. And that came out in the survey. So started there. I came in about 3 years ago and said, okay, let's look at the whole tapestry. This is diversity by doing. So let's not just keep it on gender. Let's actually look at anything and anybody that does not look like people that are currently in the MedTech system. So we focus a lot on helping young professionals because that's a real impact right now, and retaining them in the industry. A lot on pipeline, getting more people to understand and that they could be part of this business overall and the value of them being in the business. And so when I started, it was fascinating because one of the very first things they asked me to do was a presentation. So, we're talking about imposter syndrome. I come in and I always tell people I joined Diversity by Doing, which is supported by Stanford Biodesign and Fogarty Innovation. Put it up on my LinkedIn, and all of a sudden, I'm getting all of these comments. And I've been in business for a long time. I have a lot of connections, and a lot of people will say great things about what I'm doing. But this really blew me out of the water because the number of people that were commenting on it. And I'm like, what is so different about this? And then I realized it was an attribution to Stanford and Fogarty. And all of a sudden, they're looking at me like I'm in a different light, in a different place. And the pressure that put on me was almost untenable for the first 2 weeks. I was like, what am I doing? Why did they pick me? These are innovators, they're doctors. They've done these fabulous things. This is, 4-star everything. And I started to doubt myself. So it's just a really good insight into how you get into that space in the first place. Like if you don't think that that's where you belong, I'll tell you how I got to get over it as we talk through. But the first thing they asked me to do was a keynote. It's like, I just got here. So I did a keynote, and I did it on something that was personal to me because we were talking about personal development. So I dove right in to talk about imposter syndrome.
That's amazing. And while you're sitting there feeling so overwhelmed about, again, why me? How here? How did I get here? You're at two of the most prestigious incubators, accelerators in our industry.
Yeah.
That's an overwhelming feeling.
Yeah.
Well,
And actually, as I learned more, Steven, because my background wasn't there. My background has always been in working with kids that don't have the same access to different programs. They don't have access to networks that they need. MedTech actually wasn't my space when I started. So I had not only that, but then all of a sudden, as I grew into the realization of where I landed, then I was like, okay, now I'm double petrified.
Well, you've done an amazing job navigating this. For those who don't really know the mission of what you're doing, you talked about it, but you're doing something I think really exciting, even more like the college community side of it. Talk about that, because I think what you guys are doing from being able to address an unmet need is really exciting. And MedTech wasn't your background, but you've made a pretty good move into it and made some great changes.
I like to think I'm a fast learner on the academic side of it, the emotional side of it, which is a lot of where I invest my time. I've been honing that for years. So when I looked at, I said, okay, we have all of these people that are, there was two issues, Steve. One was people were leaving the industry, coming in, anybody that was a woman or a person of color, they would come into the industry and they were leaving at a rapid pace. So that was one issue. The second issue is we weren't attracting enough. So I came up with the concept of reaching out to community college students, which for the MedTech industry is not necessarily the first place they might go to find talent. But I've done programs for the past 15 years where that is the source that I went to. We went after community college students because they work harder. They're first generation. They have something to prove, and they're incredibly intelligent. So we source community college students for what a program we call Pathways in Health Technology. And when we started, it was like, okay, first, let's just get these students in here. Let's get them to understand what the MedTech system looks like. Let's let them know that, yes, you're getting your engineering degree, but do you know that you could apply it in this field? You could make a difference for yourself. You could make a difference for your family and your community. Or you can go work at any other company. You can go make cars or whatever.
Yeah.
So
Something like that.
Yeah, like that. It's just not as meaningful, I don't think. So we brought them in. And what we found, one of the outcomes that we weren't expecting is all of our students end up getting internships. Now, the companies I talked to when I first started at D by D, I said, where do you get your interns? Because we have a summer program where we bring interns in. And it's really hard to find, at this point, it was hard to find women and people of color. So they said, well, we ask our friends. And I said, okay, I get that. How about if I can help you find other interns? And they said, well, we get our interns from, and I will not name all the 5-star schools, but you can imagine. And I said, okay, all right, this is good. This is a challenge. I know I can do this. So we sourced the community college students, got through the program. Results have been fascinating. And those companies are now hiring them as interns.
That's impressive. So someone, and a lot of people don't know this, I failed out of college and honestly just a few semesters shy of graduating, but I went the community college route. I got my associates there, and I don't think people realize there's a drive for those students who feel like they've been overlooked or maybe didn't have the means to get to, 4-year university. And they will do more than someone that maybe have gone to one of the more prestigious schools, because that is what they're fighting for. They're fighting to change them.
They don't have the privilege, Steven, which that word gets thrown around a lot, but just call it access. They don't have the access necessarily. And it's a tremendous financial burden for a lot of families. So particularly the state of California, you go to 2 years of community college, you transfer to a 4-year, and all of a sudden you have saved thousands of dollars on your first 2 years of your undergraduate requirements. And I think, what I try to share with people all the time is, the resume is one thing, and your experience, your GPA, but what you actually did is something else entirely. Yeah. And that's hard to measure if you don't look outside of the things that you normally look at. So even in our programs, we have a GPA requirement, and you have to have had science or math. But I look at it, if you took French and got a D, and you took some kind of physical education and got an F, I don't really care about that. Yeah. So your GPA is a 2.5. Because of that, I'm looking at, do you really love math and science? So there's all these automated stop points put in place for so many of the things that we do today. Really looking at the individual and what their experience is, I think that's what makes a difference.
Being able to personalize, a resume, if you will, a little bit, like you may not like history, you may not like, the science, not the sciences, the foreign languages, but are you really passionate about the engineering side of it? So again, that weighted aspect. I love the approach you're taking. That's really exciting.
The by doing part is what got me to be there in the first place, because there's a lot of people talking about it.
Yeah.
But the by doing part means that the folks that we work with have things that are demonstrable. They can share. They can say, this is what I did. This is what I came out with at the end of the day. And when you see that, all of a sudden, you don't ask them what their GPA was anymore. You just it's remarkable what they come out with.
You know what I think is interesting? The by doing part you just said. I've had so many conversations with physicians, with healthcare leaders, executives. So many people talk about, well, healthcare is broken. Reimbursement rates are getting cut. All these things are broken. There's not a lot of doing. And so for people to actually do that and do what you said, that's the exciting part. And that's I think, what's fun about your program is you're not just one of the talkers, you're one of the people that are actually on the forefront of trying to solve some problems.
Yeah. And there's a sort of curtain around it, Stephen, for a lot of these young folks. They don't understand all of what happens in a MedTech ecosystem. So when we bring them in, they probably weren't thinking about going into regulatory. Maybe they're not thinking about going into clinical trials. Maybe they weren't. But now when they look at the system, they have a totally different understanding from innovation idea all the way to commercialization and market and everything that happens in between. Where else are they going to learn that?
Yeah. And I think once you get into that system, once you see what's going on, you're hooked. I mean, you don't want to leave. You see the biggest problems that are in healthcare, disease, oncology. You are at the forefront of trying to solve some of this.
Right.
What's more exciting? Your work is changing people's lives, maybe healing and curing people's issues. That's so exciting. So
yeah, that passion and energy, you see that throughout the entire programs. That's what I love. That's what I absolutely love. Now, you don't want to build a car anymore. You do want to cure cancer.
Exactly. So we can go on and on about your program. I love it. But the topic we've really come to talk about is imposter syndrome, and mainly in the medtech space. And it's something we hear about often,
Yes.
in our industry specifically. But I guess what I want to do is let's talk a little bit first about what is it? Like for me, it's this overwhelming feeling sometimes where I don't belong. I know starting a company that's trying to disrupt. I wake up in the mornings like, are we sure this is the right mission? Are we sure we're the right people to push this through and just suck it up and keep going? But
Yeah.
it's still a lot of meetings. It's a lot of things.
It is. And I think what I found when I looked at the medtech industry in relation to this is it's so technical, Stephen. It's so complex. You talked about it, the impact on patients. So what you're doing at the end of the day is really about that patient, right? And so you're questioning yourself. And I think there's a culture of perfection in this industry, particularly in a culture, it's like an expectation. Like if you're coming into this space, it is because you're fully ready to go and you're perfect. We were just talking about this earlier, about how many people just show up and you see them in their current roles and you imagine they've always done everything right and they were perfect. They're not. They started somewhere. And so I think for the medtech industry, it's those types of elements that really push imposter syndrome even further into the space than in some other industries.
It's an overwhelming feeling. Again, you look around and some people, you think they just got there. Like, they showed up at opportunity showed up at their doorstep and you don't sometimes understand what's going on beneath the surface. I think it's extremely overwhelming.
I will tell you, when I do my sessions, I have everybody in the room go through a process with me. And I say, how many in here have ever felt like they weren't good enough? How many people in here felt like they were just faking it? How many people, and by the time I get to the end, there's usually 100% of the people with their hands in the air. And that's when I tell them, that's what imposter syndrome is. And you need to look around this room and understand that everybody in here feels the same way.
That's wild. So let's talk about that group. Let's talk about that group a little bit more. How do you think imposter syndrome is really affecting different groups within our space, especially just maybe like the gender gap difference a little bit? Is it more male, female, male? Is it, or does it just affect everybody over?
Everybody always assumes, Stephen, that it is a female thing. Strategy, recent reports I've been reading talk about it. 62% of men feel it in their professional life. Now, there is a difference between how they feel in their professional life and their personal life. For women, it's around 46%, which is surprising to a lot of people. But actually, when you think about it, how much do men share about what they feel necessarily? There are gender differences in how we communicate and how we share what we feel, particularly when you get into a work environment, because it's looked at as a weakness.
It really is. I mean, if you show a sign of anxiety of like, oh, I can't do this, or I'm not here, you're afraid just to mention something to your boss. What if you get overlooked for that, the next interview, the next promotion? However, I think it's different. I think if you can harness that, and I try to, I'm not great at it, but I try to, is harness it and use this as a growth opportunity.
Right.
That's challenging to do.
Steve, I have conversations with people that work with me all the time and they're like, I can't do that. And I said, oh, yes, you can. And the fact that you said you can't, thank you, for sharing that with me, because I think it's up to leaders to really push people in the direction of saying, how do you really feel about it? I mean, it's natural, it's innate. So if it's an innate feeling, how can you just dismiss it? But then you give them the opportunity. And I think that, I encourage people to recognize that imposter syndrome is with them every day. They wake up with it in the morning. It's not going anywhere. So just embrace it. First
Yeah.
thing to do is just embrace it and know that it's there. And once you do that, then your own personal expectations, it's
Sure.
almost like, I've got to brush my teeth in the morning. Yes, I'm going to wake up, I'm having imposter syndrome. I'm going to deal with it.
Yeah. So let's talk about dealing with it. How do you really, how do you essentially take that as an opportunity?
Yeah, I think there are a couple of key elements that I share with people when I tell them about this. One is the first thing is identifying it and recognizing it, because if you don't recognize it, you don't identify it, you don't claim it, then you have a tendency to just kind of push it into this space that you can't deal with it. And I always challenge people to look at the negative self-talk, because it's self-talk. It is them saying to themselves that they can't do it, and it impacts you emotionally. It impacts you physiologically when you do that. So instead of saying I can't, the concept of I can and I'm going to kill it is always a good place to start, because nothing beats a failure but a try, right? So I think that if you go through the process and say, okay, I've got it. All right, now, instead of me waking up and saying this day's going to suck because I've been asked to do this and I don't feel like I can do it, you have to do it. And the way that you can be accomplished with it is look back at previous achievements that you've made. Think about how you felt before you had that achievement. You probably felt exactly the same way. I can't do it. But if you look back at it, it all of a sudden gives you some inner strength to say, yeah, okay, so this is just another one of those things. I'm going to do it. I'm going to be really good at it. And at the end of the day, I'm going to do it over and over and over again. So you got to focus on your achievements. We all have mentors and we all have advocates. Talk to people. Talk to, and this is what I do with my team. We have conversations about, Ingrid, how did you feel the first time that you had to do this? And I'll tell them, you know what? I didn't think I was qualified. But actually, I was, because one, they asked me to do it. It was more of something that I told myself that I wasn't qualified. And then, just be compassionate with yourself. If people are so hard on themselves all the time, you look back, I'll look back at this and say, oh, Ingrid, you said too many times, or you missed this key point. This is a conversation, Steven, that we're having. This is just it. So I'm practicing self-compassion. I'm never going to look at myself as perfect.
Like when you look at physicians and they always call it practice. We're not perfect in this. We're a practice. We're evolving the entire time. We're trying to learn how to adapt with the changes in the industries and that. I think something that I think maybe not a lot of us look at is recognizing that we may have this or an issue. Sometimes it's just like, oh, I'm annoyed, or it's, I don't know, maybe that number you talked about is a bit higher, and it should be a bit higher because we can't recognize that we do have these issues. We do have not issues, but I don't know how to explain it. Not a setback, but it's almost like it's scary. It's like
It's a
overwhelming
sliding
anxiety
scale.
feeling. Yeah.
Right. So it's a sliding scale. You're over here on the side of imposter syndrome, or you're on the side of hubris. You don't want to be on either side too
Yeah.
extreme. You want to kind of be in the middle. You
Yeah.
want confidence, but you don't want to be so dismissive of your skills that you don't recognize there are places to improve, or the impact that you're making, on other people's lives. So considering that, I think you go into a room, Steven, and if you're the only, say, woman in the room, the first thing you're going to think is, why aren't there any other women in here? And do I belong? Do I belong is just like, that's a whole title of my speech. I do not belong here, or I do belong here. But we talk about constantly having that reassurance of having people who look like you in the room. So that automatically will make your imposter syndrome kick in.
Yeah.
Or from a societal point of view, if you look around and say there aren't a lot of ex-innovators, there aren't a lot of ex-doctors, but yet that's what you want to do, you will basically deflate yourself before you even have that opportunity. So that's why it's important to remember that even though you don't see it, that doesn't mean anything. You innately are who you are, and you have the gifts that you bring to the table, and they're all different, and they're supposed to be different.
Power of understanding that, and accepting, oh, wait, this is happening within myself, within my head. That's powerful enough to understand, hey, there is something here I need to address. That's hard enough. But when you do
Well,
that, you need to be happy with yourself, proud of that. You've been able to do that.
you need to be proud and you need to understand that you know things that other people don't know. We often devalue that. And so when I joined Diversity by Doing, and I said, I'm not a physician. I don't have a MedTech background. My work has primarily been in social justice and education, in helping underserved students, whether it's under financially resourced, whatever you want to say. But then when I thought about it, Stephen, I'm like, okay, guess what I have that the people I work with may not have. I have that specific experience personally, and I've worked in this space for over 25 years. So while I may not have my MD, I know what I can do. And I look at it and I say, okay, I can change the trajectory of not only the young people's lives coming into the space, I can change the mindset of the people that are hiring them and that are going to be working with them. And when our groups, for instance, when we work with our students, our groups work together, they always come back and say, I never had that perspective that my teammate had. So now when I talk to them about imposter syndrome, I'm like, okay, so you didn't have that. You didn't have that. But putting yourselves together, you guys made a whole and you understood the value you brought to the table.
That's impressive. That's exciting. So understanding it, identifying, again, maybe you don't, or I guess not comparing yourself to the others in the room. Everyone's had a different journey to get to where they need to be. Not everyone's given this. Some have to work harder, but if you, I don't want to try to generalize this or anything, but I do feel like some of us that have had to maybe work a little bit harder might have more of that feeling than not. I know I have had that so many times. So my first marketing job, my boss says, well, what's your biggest fear? And I said, it's public speaking. I get scared to death about public speaking. The whole room laughs. Like, that's what this job is. I know. I said, I know. I have to figure out how to overcome it. And that to me was the most, honestly, I think about that almost every day, actually, because I get up in the morning and try to do a job that there's no template for, there's no book for. It's trying to figure out how to do something. And every single day I question, am I qualified enough to do so? And then I think about what I've overcome, what I've tried to get through, not graduating school, trying to work my way up, not being able to afford to go to work. And then now I'm sitting here getting ready to give a presentation to 1,000 people on a massive stage. And my biggest fear is public speaking. And
Yeah.
so like, how did I overcome it? I had to practice every single day. I woke up and knowing, man, if I fail, this could be the end of my career, but you can't have failure as an option. And you have to work at that every single day and harness that scared feeling almost. It
Yeah.
was
You use it. You
hell.
literally use it. I tell people that, when they're speaking, usually I hope they know more about what they're speaking about than anybody in the audience. So if you remember that in the first place, it's kind of like you don't need all the bullet points and scripted this and everything else. You talk from your heart about what you know. And all of a sudden you realize that you're more than capable. Now, when I was my very first corporate job, I was like you. So they were like, Ingrid, you're good at this, 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 and this. I was very young. I'm going to say I'm 25, 26. They said, we're going to send you to school. And so it's like a whole course. And there's a very old sportscaster who's no longer with us. His name is Irv Cross, former NFL player. I used to see him on TV all the time. I walk in the room and one of the participants in the room is Irv Cross. He's being taught how to deliver speeches. This man on national. So you want to talk about doubling down? I'm
Yeah.
doubling down. Why am I in this room and everything else? Unfortunately, I don't think I learned what I needed to learn there, which was to speak from the heart. They were trying to teach me and mold me to be like everybody else.
Yeah. It's such an issue.
It is an issue. And when you're raised with a narrative that says that in order for you to succeed, like you're talking about school, things that have happened in my life, in order to succeed, you have to look like this and have this, then you automatically have a lot of fear and trepidation and worry and concern about, can you do this? I think that sort of authenticity, which is a word that's thrown around a lot lately, is actually very valid.
Couldn't
Very
agree
valid.
more. In any part of your career that you're in or your personal life, people can see if you're not authentic. People don't want to work with you if you're not authentic. So if you can forget the things, the path you're supposed to go down because everybody else goes down, but you just say, hey, I'm coming at this from the most authentic and real place, you're going to do well. And you may not have to be like the leader in what you're trying to do, but passionate about it and you're authentic about it.
The
People get that.
passion is,
Yeah.
yeah.
People
I want to see the day where the leaders that are in the industry or people that are around you are really open to you coming up to say, I feel uncomfortable about this. I'm not confident about that. Them being the mentors to say, okay, guess what? I was never in this position all of my life. Let me tell you about something that happened to me 20 years ago. Let me tell you about the first time I had to give a speech. Then all of a sudden you make it really tenable and human. Now they're looking at you going, wow, I would have never thought that you were scared to do this, or you felt uncomfortable doing that, or you didn't feel like you were good enough on this team, or this particular failure crushed you. We know failure should not crush you, but it's a whole different topic.
Yeah. Failure should be the biggest learning opportunity that you have.
Absolutely.
We'll save that for another
We
podcast.
will save that for another one. Yeah, I have a lot to say about that too, Steven. So it's one of those things where if people could talk to each other and support each other in such a way that we recognize imposter syndrome, that it's talked about in the workplace. See, we do training on it for these young adults coming up, which is why I love it, because everybody that is in the D by D program ends up getting some talk about imposter syndrome. I really like that because you see their eyes light up and you know that if they weren't going through this, when they got their job or when they went into a company, it's not going to be a topic. It's not going to be a training module. It's going to be tamped down. And then you better go find out about it yourself. So the concept that we're saying, everybody has imposter syndrome, and let's talk about it. Let's put it out there and let's share and raise your hands and look around and understand that you are not alone. You are not alone is probably the biggest notion of having imposter syndrome.
Love that. And everyone has to deal with it from the personal level. And we've talked about recognizing it, harnessing it, accepting it, and using it to grow forward. But culturally as well, in the workplace, we were worried about saying something, speaking up, because we don't want to feel like we're different or get overlooked for something. I think the opposite should be there. It shows a vulnerability aspect that I'm willing to accept. Maybe I need a little bit more guidance on this or that. I wish I would have done that when I worked in one of these corporate companies, but I also wish they would accept that into an opportunity of let's talk. And I think this, to me, if I have an employee coming to say that, I'm so excited that they felt comfortable enough to say, hey, I want to work with you on this. Can you help me?
Absolutely. That's why the speed mentorship piece of what we do is so important, Steven. I end up being a speed mentor, and I always say, well, I'm a speed mentor. I don't have background in this, and I don't have these. I do have a lot of connections. But when I have my mentees talk to me, the first thing that they say to me is, so I was in this situation, and this came up, and so this group of people were talking about it. I'm not part of that group. How do I respond? See, they feel safe in the speed mentoring environment that we have because it's not their colleagues. It's not the people they work with. They can ask some real, honest, authentic questions. Now, that doesn't mean that companies can't create that kind of space, but I do believe having external parties do that have the knowledge, makes a big difference. You're not outing yourself, if you will, at a company that you don't feel comfortable in certain situations where you feel like that could count against you later on. So you can exercise your imposter syndrome symptoms with third-party people. Have that conversation.
When we started talking about this, it's a vulnerable topic, and you try to figure out how to overcome it. And most of us deal with it, I think, every day. But now I'm kind of looking at it's like, all right, now it's my Superman power. It's like my Superman imposter syndrome power, almost like, hey, this is this motivating factor, because you don't want to feel uncomfortable in your skin and that you don't belong in this and you're not qualified for it. I don't think that's the case. If you're acknowledging that you have it, I think now you've got, a superpower that's going to push you forward if you allow it to.
Right.
But how do we change the narrative now? So how do we lead it? You're working on something exciting. You said this speed mentoring. I think that's a good opportunity to talk about what that is and how you are actually trying to lead the way a little bit of overcoming this.
So what we do at Diversity by Doing is we do speed mentoring. It's virtual, which is great because we have people from all over the country participate. And we focus on 3 key areas, sort of like the knowledge piece of it is around personal development, career development, and the importance of mentorship. So you take these early, young, and mid-career professionals who are in their industry and in their business, you give them the opportunity to hear real stories from real people, that the path from A to Z is not linear, that it often looks like this, or that I started off as a janitor in the hospital and now I'm CEO of a major medical company. Here's how that happened. Stories of hope, stories of resilience, stories about how what you have been conditioned to think about how you're supposed to handle your career is not true.
Yeah. It's
So
not.
these people up there that are accomplished, they talk about where they are, what it looks like, what it feels like. And then each of the people that participate can get paired with a mentor. So they get paired with 3 mentors and they're able to ask them anything. That's the whole concept. Now, when we started this, we said, okay, it's not a long-term commitment. But what we did find is some of the connections, these individuals now have formal mentor-mentee relationships. It is not a requirement of doing it because we want it to be authentic. We don't want to say you have to be matched with this person because. We want you to say, okay, so I met one mentor in that session that totally blew my mind. The hope that people get out of it at the end of the day. And so again, it's external programming, Steven. I do talk to a lot of companies and they say, well, we have this inside. And I said,
Do you actually though?
really?
I've worked with some of these companies. I've never felt that way. I've felt the opposite. If you speak
Yeah.
up, maybe you get overlooked a little bit.
Yeah.
You know, you're
Well,
weak.
imagine we are conditioning both sides through our sweet mentoring. So we're conditioning our mentees to understand that they can reach out to a network of people, ask the questions they need to ask, get the feedback, overcome some of their issues that they may have an imposter syndrome. On the mentor side, it kind of reawakens the thought that they had to go through their career up until this point, didn't have this out. Now, all of a sudden, they see the advantage, not just with the person they're paired with on the phone, but when they go back to their company. When they go back to their company, now it's okay to ask their team, hey, I just did this speed mentoring session. One of the mentees asked me this question. Do you guys ever feel like that? I mean, that's powerful.
I mean, I did have one boss that came more like father figure. We butted heads left and right in the beginning, and it mainly because I wasn't efficient enough in what I needed to do. I also felt like I came from the operating room, and now I'm in this corporate role, and
Yeah.
I want to speak up because I feel like I'm a voice for the sales reps. It wasn't the right thing to do, and I would speak up a little bit, and I had to butt heads. And finally, he kind of wrapped his arm. He's like, "Let's talk. What's going on?" And I didn't feel like I was in the right place, the right time. I didn't have the right skill set to be able to navigate where I was. And this was probably one of the most masculine figures at this company that we worked at. He was the best mentor that I had now. Hated him at the time. Not hated, annoyed with
Yeah.
him at the time. And I look back now and I've reached out since and just thanked him for allowing that to be more of this learning opportunity. But that's not common. What you're doing is leading the way. I invite as many people that are listening to this as possible to come talk to you about this because it's needed in every major company. It's needed in small companies as
Absolutely.
well.
Absolutely. I was very lucky, Stephen, in that my very first boss, who I'm still my mentor today, and I'm not going to give my decades, but I'm going to say it's a long time ago.
A couple of years ago.
Yeah, a couple of years ago. Put it this way. She was the only female executive at Hewlett Packard in the entire region. So that's how far back we're talking. She brings me on board. I am a graduate of an HBCU, obviously a woman, and of a different cultural background. I went into that office, and if I didn't have her, I probably wouldn't be on the track that I'm on now. She was vocal about women having a seat at the table. And I will say this was in the 70s. I pull out the magazines. I used to do the magazine. It was called La Prensa. And I look at the magazines, and on the cover, it's this massive picture of all these men on the stairs, not a single woman in sight. And obviously no people of color. And I'm looking at that and I said, I made it. You know what? I think sometimes when I think about imposter syndrome, I made it in spaces that people would tell you I shouldn't have. When you, like I said, your achievements and your accomplishments, don't ever forget what you've done. That was a really good thing. And I forget until I pulled out that magazine. I was like, whoa, I didn't even realize that that was the construct that I was in at the time. So why would I ever feel uncomfortable in any construct going forward?
True. I think if you can look back at what you've overcome, where you have a little visual representation, take something, I think it is helpful. At least it has been for me. There was a first product I helped on the design team for, and that was like the baby. That was the thing that made me feel like, oh my gosh, we launched this. We got good adoption. People would come to us and say financially it changed their lives because they're able to sell this product easier based off of just conversations like this, authentic conversations of how to sell. So, and I have that not here because I'm on the road, but I have that right next to my desk. It's a small little plaque. That's a reminder almost every time I'm on something where I don't feel like I'm good enough or I'm out of the room, or I had no idea what I was doing going into there. I just knew my background and what I've learned over the years would help me if I allowed myself to help myself essentially and harness that energy. And that was something that was really hard to overcome. So I don't know if that's something that people can use or if that's something that you kind of give advice to try to harness that energy again. I think it's almost like Superman power now, if you will.
It is. It's what's your superpower. And I talk to people, that's a common question when you do interviews with people. But I always sort of try to assess what a person's superpower is as I'm talking to them, whether it's perseverance, whether it's enthusiasm and vigor that they have for what they're doing, whether they're mission driven, whether they're people, and then later on, I like to ask them what they think it is. And usually it's a 1-for-1 kind of match when they think about it. People underrate themselves.
I guess it's common if you think about it. I mean, we all, again, it's really hard to figure out, but what do you think or what has been that main superpower that you hear more than anything?
So it's really interesting depending on who you talk to. Talk to engineers, a lot of times they'll say they're really good at thinking things through step by step, very practical and blah, blah. And as I'm talking to them, I'm thinking, you're going to get tagged as an engineer, but what I happen to see here is you're a really good people person.
Yeah.
Your ability to connect with people is far beyond what you might imagine. And somebody who thinks they're a people person might be so far on that hubris scale that they're not connecting. They're actually just doing them.
Yeah.
So, I mean, it is a fascinating thing to watch and look at human behavior. But I think if people meet each other, same place, have humility is incredibly important, or be humble, then you can get past all of these issues. You can work on your imposter syndrome, improve yourself. People can improve others. And that human connectedness, Steven, is really important, which is why the whole concept of the speed mentoring piece is still there. You can't get that in a book.
Yeah. Well,
Yeah.
I'm excited to join that with you on the upcoming one. It's going to be fun.
Excited to have you join us in February. It is going to be phenomenal.
It's going to be fun, which is right around my birthday, February 13th. So it's a good birthday gift there.
All right.
So now I'm going to ask you two pieces of advice. Not as a career, but as a company, as a leader of a company, what can you do to really make sure that you are trying to identify this in some of your coworkers or your employees, if you will, and try to harness this energy and make them feel like they're wanted. This is a safe place where they actually can come talk to you and not feel like, man, I just kind of hurt my chances for that raise because I opened up a little bit more.
One thing that we have to keep in mind that didn't exist when I first started my career is the advent of social media and the impact that it has on people's psyches. People that are in the workforce now, if you are, I'm going to say under the age of 40, you're very influenced by what you see. And you're very influenced, and that guides you in terms of where you think you should be, how you should look, how you should perform, what you can ask. So people that are more senior in the industry need to understand that that's the barometer by which the younger generation judges itself. So you have to be contemporary in how you think about how you interact with your employees. To your point, lean forward and ask them anything you're uncomfortable about. Feel welcome to, and it's not a ding on you. Just because in the olden days, if you asked a question, they'd say, well, they don't know that, so they can't go have that. You gotta go. Now it should be celebrated. It should be celebrated that somebody is interested enough in advancing their career and courageous enough to say, here's where I don't feel like I'm doing as well as I could, like you and your boss did. That should be more commonplace.
Vulnerability aspect, I think, is huge. That bosses, employers should look at it and say, man, this employee of mine was willing and open enough to say, I need a little bit of guidance. I want a little bit of help. Can you help me walk through this? That to me, if someone can turn around to say that, and I've struggled with that my entire life. Family, well, kind of say, yeah, he never asked for help, and when he should have, like back into school, math. Oh my gosh, it's a nightmare. But
I was on Jack Welch as the prototype for me to be a success. So,
Wow.
his whole theory was you were A, B, or a C, and if you were a B or a C, you got cut.
Yeah.
I can't tell you how many books I read, all of that kind of stuff. That's what the people that were around me espoused and held on to and held as the standard. I don't think it's that way anymore.
Well, I still think some MBA programs are reading what he says, which, take it and then grow from it, modernize it, if you will, again.
Take what you learn out of it. Exactly, Stephen. I always tell people history is probably the most important thing in making any decision about anything that you think in life. I don't care what the thing is.
Yeah.
If you are going to look at, and I don't want to use politics, but say you're going to look at politics, you need to know the history. You need to understand. You need to have a deep understanding. So when I even look at what they're teaching in MBA classes now, it is great to look at what folks said, how much of that you want to. They also had some people that had very different levels of advice. So yeah, I love The Greatest Salesman by Og Mandino, one of my favorite. That carries true to this day because it's humanistic.
So I've not
It
read it.
wasn't just grid.
Yeah. Give us a little bit of that one, and then I'll ask one more piece of advice. But I have not read that book. So what would be from that? Give us a little summary.
I will definitely. I'll send you the title.
Perfect. Awesome. So the next one I want to ask is, so we've looked at it from the employer level. Now from the individual level. What's the best piece of advice someone coming through your program you can give them where they say, this is just debilitating. I wanna quit what I'm doing and go back to what was safe and comfortable for me. What would you tell them?
There's two streams of thought with that. One, I do believe that people should always do what they feel innately they're best at, but don't underestimate yourself. Just don't go back to what you were doing before because it was comfortable. People should always challenge themselves. Not everybody wants to be a CEO. Not everybody wants to be a VP. Some people want to be middle management, stay right there, and they're good at it, and that's great. And there's nothing wrong with that because if there was, we'd have no entry-level positions.
Yeah.
But look at it and say, are you backing out because you're worried about your capability, or is this a lifestyle thing for you? Does your lifestyle tell you that you should do this other thing instead? So just really sit down with yourself, ask yourself that question. But reach out to people, have that conversation with other people. Conversation in your mind is, there's a committee that lives in your brain that's not necessarily on your side. So have that conversation with other people, and it doesn't have to be people within your company. It doesn't have to be your family. A lot of times your family will basically put you in a spot and tell you that's where you fit.
Yeah.
So go external as an individual and talk to other people, talk to people that you admire. Get the real story, get a real concept about how they dealt with things that they dealt with and what did they do when they were faced with, do I move forward or do I go back?
I think, it's exciting also if you're talking about wanting to do something a little bit different and understanding you do have to get outside of your comfort levels to grow, to be that next level. If you want to be, like you said, the lifestyle changes, things like that. I knew for me, I wanted to grow my career. That's why I was going to go speak on stage in front of 1,000 people and almost faint before doing it. And it got even worse. I get on stage and you have your confidence screens and I look down, all of my notes are gone.
Yeah. Computer dies right before you're about to give a presentation.
Yeah. And I'm looking on stage and they've got the lights in your eyes and I look around and I see the very first person I met in sales training and he just sits there, his hand goes up. I'm like, all right, we're good. Let's go. And it was amazing, but you had to get outside of that comfort level and grow.
Yeah, you did. And I think it's what it drives individuals. My whole thing for whatever I do in life, I want to leave a legacy. What do I have to do in order to do that? And I got to step up and do it.
Talk to yourself a little bit. Understand again, what do you want to do? What are the goals in your life? Am I happy with where I'm at? Stay there, work on that, do that. And that's, there's nothing wrong with that. But if you want to grow to do something else, it's going to be challenging. You're going to have to overcome some obstacles. So.
Yeah.
Well, this has been amazing. I've really had a lot of fun and I invite everyone, what you're doing at D by D and the speed monitoring, everything, it is amazing. You are truly leading the way of trying to normalize what's going on with imposter syndrome, giving access to some of these students that may have more of a drive than where they're coming from says,
Yes.
Because my Broward Community College loved it. And if someone would have taken a chance on me then, I feel like maybe things could have been easier throughout the career, but that being said, I'd still love the path I went. And you're helping people just get to that
Yeah.
next level.
And it's your path. So the whole concept is if you feel like you don't belong, diversity by doing is the right place for you.
So where can people find you? I mean, LinkedIn, website, what's the easiest way to get hold of you, especially if someone wants to try to, volunteer their time on the mentoring side?
Love it. So I'm very into connectedness. So you can always find me on LinkedIn, just Ingrid Ellerbe on LinkedIn. We also have a Diversity by Doing a LinkedIn channel. Our website, pretty straightforward, a diversity by doing.
.org.
Yep. And I believe that's the whole, yes, diversitybydoing.org. So you see all of our programs there, opportunity to volunteer there, opportunity to sign up for news and information there, anything you want. We are very open to having conversations with people because we want to change the world.
Love your mission. I love what you're doing. And again, if anyone is feeling this, please reach out to me too. You're not going at it alone. This is something we all have to overcome or accept or use as your Superman power as much as you can. If you can harness it, you're going to do some great things. So everyone, thank you so much. Ingrid, thank you so much for joining. Please follow and help us share the message. Thanks, everyone.